Welcome back to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster. My guest today is Dr. Toby Cosgrove, the former CEO of the Cleveland Clinic. Dr. Cosgrove, it is a pleasure to be here with you today.
Nice to be here. Thank you.
So we're here at the health conference. You're seeing all sorts of innovative companies, founders, not only in the startup area, but all across the board. What's exciting you today?
Well, I think the exciting thing is you're starting to see the private sector beginning to influence healthcare. And I think healthcare for too long has been too stagnant without a lot of external input. And I'm delighted to see all these new ideas and new emphasis and new thinking coming towards healthcare.
Who are some of those players who are coming in that you're happy are here?
Well, you know, for example, this morning I talked with the CEO of Clear. And Clear we recognize from our trips to the airport.
Yeah.
We don't think about Clear in healthcare. But, and there is just, everybody is trying to figure out how to bring new technology to healthcare to make it better for patients, less expensive, and higher quality.
I see Microsoft's symbol over there.
Yep.
Instacart was right over here. It's really fascinating to see. Is there a sector that you're most excited about right now?
Well, yeah, I think that one of the things that's going to happen is we're going to see enormous influence coming from large learning models and AI. I think that's going to be transformative.
Yeah.
And it's going to touch every aspect of our lives in healthcare and a lot of the rest of the portions of our lives. I think it's a transformative moment.
Yeah, absolutely. I mean, I've heard a lot of different perspectives in this chair about AI and about LLMs, and I wonder, given your macro perspective from your time at the clinic, do you have any cautions? What are some of the cautions that you feel about AI right now?
You know, I think any new technology poorly used by bad people has bad potential.
Yeah.
And I don't care whether it's gunpowder or atomic bomb or cars.
Yeah.
They all have a downside. And I think it's, but the upside of this is so big that you can't put it back in the bottle. In fact, you couldn't put it back in the bottle if you wanted to.
No. You can't put the toothpaste back in the tube. You are on the Startup Health Board of Directors. Talk to me about sort of what drew you to that project, because really it's a long-term journey that we're all on together, building these collaborative communities.
Yeah, I think the nice part about it is it's bringing together people with all different capabilities and different thinking to try and solve a problem. I think the best way to put it is we're all better together.
Yeah.
And sharing ideas, learning from each other, and this is how things ultimately get done. Very seldom does one person change the world.
Yeah. I mentioned that you were former CEO of the Cleveland Clinic. How long ago was that you left that post?
I left like 5 years ago.
5 years. In those 5 years, how have you seen the sort of macro conversations change around just an appetite for innovation?
Well, as you know, COVID happened in that period of time, which really put enormous pressures on healthcare. From a financial point, from a personnel standpoint. Yeah. And a lot of the technologies are going to be trying to address those aspects of things. This has been a real game changer for people in healthcare.
Yeah. If this video was used as a call for innovation to a future founder who might join Startup Health, is there a business that you would love to get pitched, whether more generally or specific?
Listen, I think that healthcare has got so many different segments to it, and all of them are moving fast. I've seen changes of people building artificial organs, actually building lungs. I've seen people have new technologies for monitoring, and I've seen new AI applications for treating chronic diseases. I've seen new opportunities in drug delivery. Yeah. And the potential is enormous. And so I don't think you can say, well, that's not possible.
Yeah.
It is possible.
Yeah, yeah. You were a practicing heart surgeon before you led the Cleveland Clinic. Do you feel like there needs to be, do you feel like more practicing physicians need to get involved in health innovation in startups?
Yeah. Very few companies think of something de novo. And whether it's developing a heart valve or whether it's developing a new antibiotic or, a new way to do it. So you have to bring the physician group along. You have to get the ideas from the physician group. You have to understand their problems, their pain, and address those sorts of things.
Yeah. I watched a video not too long ago that I believe you worked on when you were at the Cleveland Clinic that was about understanding what somebody's going through, that you know a video I'm talking about. You see somebody at the hospital and you don't know kind of what their life is like outside or what they've just been through, whether they just lost a loved one. And really it's all about empathy, right?
Yes.
Understanding. You remember the video. And I'm just wondering where you feel like we're at right now in terms of the industry's embrace of empathy.
Well, let's bring it down to what is quality in healthcare. And quality in healthcare really comes down to three things. It comes down to the clinical outcomes, which generally what we talk about and measure. It comes down to the physical experience of being in the hospital or getting healthcare, and it comes down to the emotional. And those are three things that needed to be addressed, and empathy is a part of the latter two.
Yeah. Last question. What are you most excited about specifically in your work with the Startup Health Board? What are you excited about for the next year?
Well, I think I'm really excited about the opportunity to begin to help entrepreneurs understand their journey and what is expected of them and how they can become better entrepreneurs and bringing new things to the healthcare delivery.
Love it. Dr. Cosgrove, thanks for taking the time with me. Appreciate your leadership in our innovation community, and hope we can have this conversation again.
I look forward to it.
All right.